having a gender-specific program is really, really important. There's a lot of emphasis these days on trauma-informed therapy, trauma-informed treatment. And what we know about trauma in women is that it can be a lot more sensitive to try and work through trauma in co-ed groups. So having a gender-specific group really allows the women to go into depth about issues that they need to talk about that they might not be able to feel comfortable talking about with men present. There's also topics that we can address that we wouldn't address if there were men present. Issues that are specific to women, things like hormone imbalance, certain types of mental illnesses that are more prevalent in women than they are men. We can really talk about those things. Relationship dynamics. We know that for women, relationships have a whole different meaning in identity development. So we can really explore that with women specifically without them feeling judged or intimidated or any of the things that they may or may not feel with men present.
What we've done is created a program that first off educates around what is trauma, allowing the women an opportunity themselves to know from their own experiences whether or not this is something that is ongoing and continuing to be an impact to their lives. But we also assess for it in a clinical way, so we have them complete a questionnaire related to trauma that gives us as psychologists an ability to find out whether or not, number one, have there been traumas that have been significant in their world, but more importantly, I guess, secondly to that, is it something that they're experiencing difficulty dealing with still in today's world for them, and what can we then do to assist in that process?